Behind the COVID medical front lines, a time to reflect. Hello everyone, welcome to Signpost for Living with Dr. Kirsten Hunter, and we have got a gorgeous special guest here, and we're going to call you Sally H because she's a lady of mystery. No, strategically, yeah?
Yeah.
Everyone, thank you so much for coming. So when Sally and I met, I got very excited, apart from meeting you, because your background was an area where I was hoping to find somebody to have this incredibly valuable conversation. Have you ever done a podcast before?
Only one.
Have you?
Only one.
Yes. I haven't asked you this.
Yes, only one, but it wasn't as fancy as this. So.
Well, I really, really appreciate you coming along.
Thank you for inviting me.
Yeah, so we were just talking, we're 2023 now, we're December, we're heading toward the new year, and COVID was, in Australia, was March 2020. So we kind of, three and a half years.
Almost 4 years, really, from when it really hit.
Yes. Isn't that extraordinary?
Unbelievable.
Sometimes time can feel short and long at the same time.
Yes. Yeah.
You
when
agree?
they say long days, short years, things like that. I think that's kids. But yes, it's quite unbelievable. The time still passes, but in the midst of it all, sometimes it feels like it's very slow. You just want to be at the other side of it for sure. I think especially the 2020 and 2021 definitely just wanted it to be over, wanted it to go back to normal. But yes. Yeah,
I mean, time would have slowed down very much during those days, for sure.
Yeah, very much so.
And with COVID now, I mean, we'll get into it, but I personally have a bit of survivor guilt because I was minimally impacted, honestly. I mean, me and some person in some forest in some jungle, we got off pretty good.
Yeah.
But yeah, I despite that, I feel very confused because it feels like it was not long ago, but yet such a long time.
And I think it changed a lot of things for people in general, but I think anyone who worked on the front line during, particularly in places where it was particularly bad, or we, had a lot of poor health and things like that, I think it changed us. It changed how we see ourselves and how we work, and changed our relationships as well.
Pivotal experience, pivotal moment where you just change direction, you've got a different life experience, and that framework carries through.
Very much so. I remember during a lot of the lockdowns and a lot of the sort of more difficult and challenging parts, a few people said they felt like they were in a war. Like it really felt like it was such an altered existence, wasn't it? Yes, that's right. A really different existence and a very almost surreal experience, particularly in the hospitals, which is where I work. And I was in Melbourne at the time. It was very surreal. It was a very surreal experience.
So let's get into that. Let's get. I'm a wee little Queenslander up here, in Toowoomba,
living the life
near Brisbane. Very protected up here, really. Honestly,
very protected, unbelievably.
Our amount of lockdown was, I don't even know how many weeks it was, and I didn't stop work. And
no,
I, honestly, I kid you not. I didn't go to restaurants.
No, that's good. I'm glad.
No, because they shut down for a matter of weeks. Like, seriously, I was very untouched.
Yeah.
But way down in Melbourne, bottom of Australia, completely different picture. So can you tell me a little bit about your job? What do you do?
Yeah, so I work in infection prevention and control. So,
of course you do.
Yes, I'm a nurse.
Infection protection.
Prevention.
Control.
And control. So ideally we prevent, but when we can't prevent, we control the spread of infection within hospitals mainly, but also too we do try to keep things as safe as we possibly can for our patients. We jab things in people, and we give people medications that make them really sometimes unwell. So patients can be very vulnerable to infections and becoming really, really unwell and sick with those. So we work to try and prevent any spread in hospitals, and also to try and stop the spread of antimicrobial resistant bugs in particular. So they're the ones that we eventually won't be able to treat with antibiotics. So we don't want those to spread around that much. And so we work to try and prevent that spread. But obviously, when we also do respiratory illness prevention and control as well, so we manage outbreaks of those. We manage exposures if there's a patient that's exposed to a particular bug in the hospital. We manage that, but COVID kind of came and changed our job dramatically at the time.
So when we say you being on the front line, it's literally your job.
Literally was our job, yeah, to try and prevent the spread as much as we possibly can, keep our staff safe, because obviously, especially at the time in the beginning part of the pandemic, staff weren't vaccinated at all. And so, staff, if they became unwell with COVID, got really, really sick, really unwell, and it was very confronting, very scary for people, and obviously wanted them not to. Yeah, not to
and staff would be in the position to accidentally spread it as well.
Yeah, and that, terrible situation if staff, were responsible for, particularly in aged care, I think, if you were very, working in that environment and trying to care for your residents and keep them as safe as they can at the same time, you take that into the aged care setting, it would be really confronting, really awful situation. And I personally didn't know anyone that was in that circumstance, but I certainly heard of stories where we know that staff became unwell, and then, and that was the thing with COVID. And that's why it was so clever at spreading, was that you are infectious for a number of days before you become symptomatic. And so
catching, preventing,
very, very difficult. The horse is already well and truly bolted by the time someone comes up symptomatic, and so it's quite a big task to then try and identify all the people that might have had contact, and including staff, and keep everyone safe.
Yeah. So can I ask? There you are travelling along, pre-2020. Had you imagined something like this ever happening?
Well,
because I'm a visual person. I've got this image of you like being on this little boat, and there's these waves, and you're like, oh, we managed that one, next one. There's always something coming, and then this tsunami comes. Yeah. Like, had you anticipated the corona tsunami?
So, in a way, yes. So we, there's always something. There's always some organism going around, and people would be aware of that. There was the SARS outbreak that had previously happened. So I think it was 2009. So, it wasn't... It was a funny thing, because people always talk about this once in a career pandemic, and everyone, like almost...
Is that like a badge?
Well, possibly beforehand. And that's what I mean. Like, you kind of have this romantic idea of what that would look like, but you just can't imagine it. You can't imagine the magnitude, and I guess just the things that you had to do, and the impact of it in terms of the spread. And when obviously we, even in Melbourne, we were quite well looked after in terms of, if you compare the situation in Italy or New York and places like that, like, we did fare quite well. We didn't have that situation where the healthcare system, was just so affected. Isn't it?
It's all in context.
Very much.
We're talking about Melbourne, which was the most severe area in Australia with regard to lockdown anyway. Yeah. But really, Australia, relative to the world, was relatively untouched.
Yeah. I think in terms of impact on health system, I definitely think that Melbourne and then Sydney were the most affected.
Yes.
I know for comparison's sake, would try and explain to people outside of those areas, the impact of on ICU, for example, and our need to expand for not, huge amounts, and just be prepared to get bigger and bigger and have 3 or 4 times the amount of ICU beds and cope with that and staff a unit of that size. And that's the thing, like it's not just providing the beds and the ventilators and all that sort of stuff, it's staffing that, right?
Staffing, having the equipment.
Yeah.
And I recall talking with one person that even as simply as the air conditioning,
oh yeah,
cycling through huge infected areas to non-infected, and trying to get the infrastructure right, which they didn't have.
No.
So the ripple effect is enormous.
Even people sort of, I guess, didn't talk a lot about it, but we access to the correct protective masks and PPE, whereas it was an issue at different times because the supply chains all just dried up.
Yeah.
Because we weren't able to bring any PPE in, we weren't able to source it. So at one stage we were all trying to work out, what are we going to do if we run out of masks? It's quite a strange situation. Everything literally is affected, and you don't think of those things. Even recently I was talking to someone about pandemic preparedness, and I made that comment about supply, and I was like, but the supply chains will stop. Like,
it's almost like we need to stockpile.
Yes, lots of places did, but all tried, I think. But there was good governance over that. Well, certainly in Melbourne anyway. In Victoria, there was good governance around it. So, everyone was just trying to do the best they could, which was, a really great thing to look after one another.
So Dylan, can I ask you, was your engagement, involvement a macro level? Were you looking at data across the state where what's happening? No?
I was looking at really individual cases. So
really?
Yeah, so we would get notifications that we had positive cases.
Yeah. And
we would need to follow those up and see if, was there any risk to anyone? Was there any risk to staff? Was there any risk of exposures to others? And we would follow that up. And
this is all before the vaccine, right?
Yeah. And that's a thing, you could really draw a line in the sand and say before vaccine and after vaccine, because the impact and the severity of illness before in an unvaccinated population is just, you cannot compare it to a vaccinated population.
Yeah.
And so even now, I know people can be quite complacent about things, and that's fine, but it was a very, very different situation.
Well, now we have a largely vaccinated population.
100%, yeah.
So,
well, we're largely vaccinated. I think we're well over 99% of the population has either been vaccinated or had COVID at least once. So, everyone has a level of immunity, basically. There's very few people now who haven't had some sort of exposure, either through vaccination or through having the illness. So, yeah, so very, very different spread. Also, too, there's the different variants as well. So, and that was the other thing that made a really challenging situation, is we just would get our heads around one variant, and we'd sort of work out how we would deal with that and manage risk with that, and then another variant would come along and
is that because they behave differently?
Yeah.
I understand some are more contagious than others, but I didn't know they behave differently.
Yeah, so even from something as simple as there's a couple of different exposure events that people might be familiar with potentially, but in the first wave, as they were called in Australia, we called them waves, or some often call them waves. In the first wave, it was very easy to identify who had been exposed, even to a point where, we would sort of say, have you been this close to the person who's positive? And they would go, oh, yep, I sat we could look at seating on a plane
Wow.
map, for example, and we
Yep.
could almost draw a ring around it. But when the second wave came through, it was a much more difficult situation, and there just didn't seem to be any rhyme or reason.
Really?
Yeah,
It wasn't because the ripple effect was larger?
No,
It was like-
no. It was the organism itself or the variant just behaved differently, or and there's different types of transmission. So there was a bit of contention around whether it was spread via droplets or spread via
You don't
airborne
need that.
transmission.
You need to understand the beast, don't you?
Yeah, but we didn't there was no real way of knowing for sure what we were managing. It was a very difficult, tricky situation.
It must have been incredible pressure to be the expert in the field when you guys were all students trying to learn and
Yeah.
trying to comprehend what's going on.
There was a really good saying that that a few of the sort of experts or, you know, influential people were using at the time, that we're building the plane while we're flying it. And it was 100% what it felt like.
While people were falling out.
Yeah, basically. We were building this plane and hoping, you know, and flying it at the same time.
How does that fit with your personality? Do you need a lot of control, or are you a pioneer?
No, well, it's really changed how I look at my role, I guess. And it has definitely made me question, I think particularly in aged care, what this balance. Before, there used to be for me a right answer and a wrong answer. And I have to say, I think probably professionally nurses like black and white, and probably even medical staff as a whole like things to be black and white.
Yeah.
And I realised probably a little bit too late, but I probably realised a fair way into it that there was no black or white, and all we could do was to make decisions with the idea that we would be with as much information as we could get about a particular situation, and with the best outcome in mind, with weighing up all of the different bits and pieces. And
The sheer complexity.
And, you know, I remember we would get phone calls from staff about, you know, what do we do with this? What do we do with that? And I'll be like, it depends. And they're like, why do you keep saying it depends? I'm like, because it does. It depends what ward you're in. It depends what your what you're talking about with the air conditioning and the air handling systems. It depends on your population and who you're talking about. Are you talking about, you know, immunocompromised people, or are you talking about, you know, people who are generally fit and healthy and have come in for some other reason? And I was like, it depends. And everyone was like, oh, we hate it. It depends. And I was like, I know, but that is literally what we're dealing with.
So we're talking about your immune system, really, and the environment.
And the environment. Well, there was always constantly this flex back and forward of you know, well, it's this situation in this room for this long. Was there coughing? You know, it was even that. It was so hard just to have these set black and white. And so it did, I think, make people for a while, and the rules changed all the time. That was the other thing that made it so hard.
I don't know about you, but up here, it was constant sort of reels of information. Okay, current policy, policy, and trying to educate everybody. And it was just this machine that was evolving.
Yes.
And it was exhausting.
It is.
You could never get comfortable and say another
never.
day at the office.
And it eroded people's, I think, trust in potentially in us to give direction, because then the rules would change the next day and they'd be like, why did you tell us that? I'd be like, well, the rules changed. So what I used to say to people was, this is the rule today. I can't promise you it'll be the rule tomorrow, but today this is what the rules say.
We're all learning together.
We're all learning, that's it. So yeah, it was it's really changed how I see my role, and I think it has made me a better advocate.
It's very humbling, I think, for the medical
very
model.
Much so. Yeah, very much.
Can I ask you, when you were, here we are, we hear about this COVID epidemic coming in, and you have to go and step into that space. And, it was scary. It was unknown, it was scary. There was this concept of, all these dead bodies would happen somewhere, somehow. It was really scary. And that was accurate.
It was.
That many people did die. But I guess I'm wondering, on a personal level, what was your emotion like? What was your fear like?
Yeah, it was a very, I definitely became quite disconnected and disassociated from, I think, certainly from my family.
What do you mean?
You kind of, when you're in that situation, and particularly for us, because we were working extremely long hours.
Were you?
Yeah. So we were working from sort of 7 in the morning until at least 7, and then we'd generally go home, or some people would go home and then continue to do work when you got home. You could have worked 24/7. It just was constant. You were constantly trying to manage a workload that never
just kind of keep the wave at bay.
Yeah. And it really was. And you couldn't, like we used to say, we want to get off. I want to get off this roller coaster, and you can't, because you've got to. And you have, I have a family that was at home, and husband who was homeschooling our children, and but by the time you get home, you've got literally nothing left to.
And your kids were little, right?
My kids were little, and
so that's scary, isn't it?
It was
as well?
Extremely scary.
I think when you've got elderly and you've got scary, young children, both age groups are quite scary.
Very scary, and I know even my kids, even now, if someone gets COVID, they'll go, "Are they going to die?" Like they
really?
they still, if someone got COVID to them, they're like, "Are they going to die?" And
because mum was off and COVID was the bad.
I don't think they ever made the connection between me necessarily and that, but it just like, we were in lockdown. So
okay, so let's just explain to Australia at minimum what lockdown in Melbourne was, because in where we were, lockdown was, I don't know, 6 weeks? No. Can you tell me?
Nothing.
My beautiful John's here, and he's got a great... No, there was a little lockdown, wasn't there? See, the point is we don't remember.
You don't even remember. So
you know,
it's very profound.
The restaurants were shut. Like, that's pretty
and
much
that was it. Yeah.
No lockdown at all.
No.
There you go.
No.
See, right. So,
So
incredibly
we were
fortunate.
proper. We went into proper lockdown.
Talk to me about Melbourne lockdown.
Yeah, so we were only... So we were in our houses. We were not allowed out of our houses other than to get essentials, which in Melbourne included coffee, so that was good. And none of the coffee shops closed.
True Melbourne.
True Melbourne. Coffee shops, only takeaway though. Groceries, food you could collect, but other than that, you were only allowed out for an hour to exercise.
I genuinely am astounded that coffee was included as essential.
Oh, it is essential.
Well, it's a mental health issue.
It is. It would have been my mental health issue, I assure you.
Wow.
Yeah. So and even the other day, I was talking to someone about they were like, oh, but people wouldn't have checked, would they? And I was like, we had to drive around with permits, and my line manager would write out my shifts on my permit, and you would carry your permit around in the car so that if you got pulled over for being on the road, they would look at like, yeah, you worked. Yep, you're allowed to be on the road.
What a surreal world. It
was very surreal, and so like it's not like you could get away with it. Like
how long did this lockdown happen in Melbourne? I had a lot of clients who were phone sessions in Melbourne who were really, really unwell because they were isolated in their little units.
Oh,
but I don't know how long.
I think our longest one was like 120 days or something like that. Like they were months and months and months long. The second wave was the longest one that we had. It was by far the longest.
So months at a time.
Months and months at a time. And the worst bit was that it got to a point where they just do snap lockdowns. So you'd get the notification at midday or 2:00, and then that night you went into lockdown at 8:00, and like it just was. So one of my kids was always like not wanting to say goodbye to people because he was like, I might not ever see them again. He's like, or I don't know when I'll see them again.
Yeah.
He just was so affected by like that saying goodbye, and then that night going into lockdown and going, I don't know when I'll see my friends again. I don't know when I'll go to school again. So and it's just the craziest thing when you think about it. But we were literally in our houses all day. Well, other than me, I was at work. But yeah, you're in your house all day. You can't leave. You just are there, and you can go out for an hour, and you know, we had amazing parklands right near us.
So you could go walking, but you had to keep the distance and
had to socially distance. You had to wear a mask.
Yeah.
And it just was, it was just a really weird.
So all this
experience.
Like solitary confinement in the comfort of your home, but nevertheless, not having choice.
No,
we don't go well with that, do we?
No, and it was I can't say it was all bad. Like, it really did make us a very tight little family. Like, my husband and I, my kids were very tight. So much so that people actually would kind of, like, when we would see people who hadn't been in Melbourne with us, or they'd be like, why do you guys just do everything together? Because we kind of move around in, like, this little bunch, this little unit. It's like, because we've not done anything without each other for 2 years.
We saw some trends happening here in Queensland, which I imagine you saw. We saw people who were in relationships that were about to break up, quickly breaking up because they knew they couldn't be in the same space together. So it made people a bit decisive about breaking up.
Yes.
Can't stand you, I'm out.
Yeah.
So a lot of sudden breakups happened. We had
probably a good thing.
Yeah, we had a massive influx of animal ownership. You know, because people knew that they really needed that cat or their dog. Fish did not particularly fare well. Cats and dogs did. And we also had a lot of people doing do-it-yourself. I always get that wrong. Is it DIY?
DIY,
I always go DIY. DIY, you know, because they're at home and they're wanting to make their castle that bit more homey. So, you know, that was a big... that's what we saw here.
Yeah.
Did you see that?
Yes.
Yeah.
Yeah, big time. Especially I know at least a handful of people who got puppies. They're like, oh, well, if I'm going to be at home, I might as well get a puppy. The problem is if you have a COVID dog, a COVID dog.
So COVID dog is if you get it because of COVID, right?
Yeah, or
never heard of that. Good.
In lockdown.
Yeah.
They are the most codependent animals. Like, because all they know is you being there all the time.
What are you doing going to work?
Yeah, why would you
go
to work? Why would you leave me? You're supposed to be here all but an hour every day.
We've got all these anxious dogs.
Yeah, totally. Oh. I know our dog's anxious now.
Do we have, like, slightly pissed off cats? Like, get out of my space?
I don't know. I'm not a cat person. I've never had, so I don't know. But it'd be worth asking cat people if their cats just like, get out. I need space. But funny. Yeah, it was quite a surreal experience for sure.
I'd be interested in people's eating habits and also their alcohol use.
Yeah.
I know people who really got onto some pretty heavy drugs during that time.
Really?
Absolutely. Yeah. They're on their own. They're isolated. What the hell?
Yeah.
But,
I would definitely say alcohol usage, like I definitely drank more than I would have normally, because what were you going to do? Like, you got to a certain point in the afternoon and you're like...
kick back.
There was some really lovely things that happened, though, I have to say. Melbourne in particular, like, you know, I wasn't anywhere else, so I don't know, but these amazing pop-up restaurants that would go around and do takeaway, like really flash, beautiful takeaway. They'd take over a local cafe and just do, because you couldn't go more than 5 kilometres. So if your favourite restaurant was 7 kilometres away, you couldn't go there. So they were doing these pop-ups all over. It was amazing. But the other thing that we started doing was FaceTime dinner parties. So we'd set our menus out and...
really?
Yeah. And you'd all cook the same thing and you'd all, like, put it on at the same time so that you were going to...
that's really beautiful and really sad.
I know, right? I'll tell you another sad one. My mum's group... one of the mums organised these amazing little mini cocktails. So they sold them in these little glass bottles, absolutely beautiful, very Melbourne-esque. And she drove around to like 20 houses in the area putting these little cocktails behind our letterboxes. Oh. And we all had a Zoom cocktail party
that's
with our little...
really
isn't
beautiful.
That the cutest thing?
See, that's just thinking outside the square.
That's right.
That's endearing.
Yeah. And I think we thought it'd go for about an hour, and I think we were all on the Zoom for... We all kept having to register with Zoom to get it. It was really great. So there was ways that you...
I think we're very creative, you know.
I do think, though, I think, you know, we were lucky in that way. I can't imagine being a single person sitting in an apartment
the clients that I spoke with were university students who went down. They were on their own in units, and they were isolated and getting depressed. Some got psychotic. Yeah. Oh. Yeah.
I could totally understand how you could, because it is quite surreal. You're quite disconnected from everything.
You know, here we are 2 states away.
Yeah.
And the parents just beyond themselves with distress.
And you had no choice. You had no control. I think that was the biggest thing in terms of the public, was just not having any control over your existence. You had no control really over what happened or what you could do.
And there's that element of not knowing when this is going to end, how it's going to end. You know, if we can cope very well when we know that the movie's going to end and what the outcome's going to be, but the uncertainty would have been really, really depressing in that you can't have hope without a horizon,
no.
You know? That hopelessness.
It was, and I think for kids in particular, very, very hard to parent. I know for us, we're very much, you know, we're leaving in 5 minutes. You know, we're going to do this. We give a lot of notice. We set plans out. We don't, but there's nothing you can do when you go to school one day and then you come home and then you find out that you're going into lockdown that night.
And there was all these parents that needed to work at the same time as schooling their children, which is impossible. And, you know, our beautiful John, he was schooling our 2 little ones. Yeah. And in your hubby was schooling, and you know, but how do you work at the same time? You can't. So it's a problem.
It is a problem. It is definitely, and I think you know, I think I always say COVID shines a light on the darkest areas and the hardest areas. Like, you know, we were helping with prep and, you know, grade 2. If I was trying to teach grade 10, 11 physics, how do you do that? Also, like, my husband and I are very literate. We, you know, both
very
capable. What happens if you have literacy problems or those sorts of things? COVID had a way of shining a light on the most disadvantaged, on the most...
Do you mean highlighting?
Yeah, or just seemed to impact and really, really impact and highlight those injustices in the world. You know, those kids who...
Those who were fortunate had resources.
We were extremely fortunate.
Did well.
You know,
those that didn't.
And yeah, it just really always used to impact on me. And I think, you know, we were in such a lucky position. We were, you know, you joke about how sick of each other you were, you know, within marriage, you know, being stuck together. But there's a lot of people who are legitimately in situations where they probably, you know, don't want to be at home all the time. And, you know, kids, adults, and yeah, I think those in the community that were the most vulnerable in that way were really...
And I think the isolation is profound. There's one person I know who thought it would be a good idea at the beginning of the pandemic to go and house sit. The house sitting was a full-blown extreme mansion in the countryside. And this person was alone in a mansion in the countryside for months and months and months. And, you know, it looks really romantic. It looks really extraordinary. You know, he had everything available. He became acutely depressed, acutely depressed. His highlight was when groceries would be delivered and he would wave through the screen door.
Yeah.
You know, so yet other people could be in shoe boxes but with loved ones, and you know they'd be having a laugh and you know so overplaying, you know, but you know it's different.
Yeah, it's different.
Yeah, so it really was a very different experience. Can I ask for yourself, your kids, family, husband, when you guys got how do you like that? COVID, how I'm assuming you got it, did you? Yes. And
ironically not in Melbourne, but that's fine.
Are you serious?
100%.
What?
We did 2 whole years, no COVID at all.
In Melbourne?
In Melbourne, yeah.
Came to Queensland?
Came to Queensland. Bang.
I've never had COVID.
There you go. You're in the, 0.02%.
I'm touching wood.
Yeah, touch wood.
Yeah, but my best friend died of COVID.
Oh.
So,
Yeah.
2 sides.
Yeah.
But basically I'm wondering, when you guys got it, did you have a heightened fear because you'd spent this whole time fighting this, virus, and then, your loved ones got it? Had you developed a heightened fear?
We were all vaccinated.
Yep.
And if we hadn't been, then yes, I would have. Particularly one of my children who has a chronic health problem. We were literally counting down the days till we could get the kids vaccinated.
Right.
That's how much that impacted on. And I have huge faith in the Australian program around vaccinations and around that, and so I was just hanging out for that. But no, once I suppose a little bit maybe with that, but nothing like what I would have been like if we were in Melbourne and we were unvaccinated. I saw entire families get wiped out, wiped out and sent to hospital, and or worse still, parents going to hospital but children being at home, like little children being at home trying to manage with really sick really challenging situations, because you don't think about that stuff. But if you're all in lockdown and no one's visiting, seeing each other, and the parents are wiped out, how does anyone know that necessarily?
It's scary.
So you'd have these little kids who are trying to manage. So yeah, it was I didn't have that fear because we were vaccinated. But if we hadn't been vaccinated, I would have been terrified. Yeah. And we did a lot to make sure that we did not expose ourselves, or particularly our children.
So it is a political issue, isn't it?
Very much so.
So, when the immunisation was coming out, there was a lot of conspiracy theories, there was a lot of anti-government. How did you react to hearing all of that? Everyone was working their asses off to find a solution, to innovate at a time of crisis. And then there was this big pushback, which, was very divisive, wasn't it? So
it was extremely divisive.
And you mentioned trust issues as well.
Yeah, and I'm not going to go into that fight pro-vaccination, etc.
No, but how did you feel?
Yeah, it was the most, I think for us it was really sad in healthcare, particularly those who were, I didn't work in COVID wards, but I worked, trying to look after people and look after staff, to then be sort of challenged all the time on our, our intent, or, people thinking that, healthcare workers were lying, or, part of a conspiracy, when, really we were just doing our best to try and keep everyone as healthy and as safe as we possibly could. And, at the end of the day, we're just hospital staff, or we're just healthcare workers, right? Like, we don't work for the government, or we work for the health system, but we're not in the government, from a bureaucratic perspective.
No.
We're just going to work and doing our job like everybody else.
Yeah.
And, everyone who works in healthcare does it, or I've not met anyone who doesn't do it because they want to make a difference in the world and they want to look after patients and caring. And, you know, I've seen, you know, amazing people do amazing things to save people and to care for people. And then when you have that questioned and your integrity questioned and you're just fighting so hard and working so hard, you think, like, are you for real? Like, can't you see there's a difference between, you know, what we're doing and what we're trying to do versus, you know, the political side of it, if you like.
You know, I think it comes into the area of appreciation. We can do extraordinary things when we're appreciated. When we're not appreciated, it really impacts on our morale and
hugely.
Our, you know, our just sheer energy.
Yeah, absolutely. It is 100%. And I think if you spoke to people who are still down there potentially in Melbourne or who have left, because there are a lot of people, particularly nurses, who've left the profession, which is just so sad.
Like burnt out?
Yeah, burnt out. Fair. But also like just lost their love, I guess, of it after being through that situation. Because I, you know, the sheer amount of work that people were doing, even now, you know, when we have these waves of COVID, the impact on workforce is unbelievable.
What do you mean by that?
So, you know, if you've got large numbers of people getting COVID in the community, that automatically means that you've got a large number of staff getting COVID.
Right.
So your staffing is just down straight away, you know. And so when you have these waves, you'll have staff who are not there, and everyone else has to pick up the slack. And so then you've got people working doubles, you've got people working, you know, 7 days straight or 10 days straight because there is no one else.
Yep.
And so there's no one coming to save the day.
Yeah, it's a ripple effect.
It is the ripple effect. And so even now, when we have these waves, you still have that impact on workforce. And so people were just working so, and they weren't nice shifts. They were like working your backside off, not going to the toilet, not going and having breaks, just working to look after people. And I think people just got to a point where they're just tired and
you've got to look at life balance, right?
You have to.
You don't live for your job, theoretically. And if your job is detrimental to your mental health, at some point, and physical health, at some point you've got to make a call and say, this is not okay.
Yeah.
So I can understand that, you know, for the greater good and a sense of urgency, that initial push, but there would be a point where you have to stop and reflect and go, no.
Yeah.
Self-care.
And that's where that not knowing where it's going to end had a profound effect. Most people can push, like you say, can push through for a period of time. But, you know, when you've got that for 4 months, 5 months straight, you're just so burnt out.
You need the finish line.
You need to know where the finish line is. And I would often hear people say, I just don't think I can do it anymore, you know.
Can I ask you a big question here? Okay. Say this world of COVID never happened versus the truth of that it has. How has it changed you?
I think for me, as with any challenging situation, I think it's made me appreciate the complexity of every situation and to value and be grateful for the relationships that I have, both like, you know, personally, because that obviously plays an important part on getting through any type of situation. But I think professionally as well, it's made me understand and appreciate that a lot more, whereas I probably was a bit of a rules person and a bit of a, no, this is the way, just do it type thing. I think that complexity, have a much greater appreciation of that than I had previously. And I think that comes anytime, right? Like, there's a saying that once you, the more you know about something, the more questions you have.
Yeah,
you know?
circle of knowledge. The more you know, the more you know you
don't know.
Yeah, that's true.
I do feel like that. I feel like, we've all been through this crazy thing, and all that it's done is shown just how complex the world is.
Do you fear the next tsunami of epidemic?
Yeah. I don't want to be here. Pandemic. I don't want to be here for it.
Really?
I'm not, nah.
You're like,
I'm Darren, they told me. I'm done. It's one
I'm
per
young
career.
and gorgeous, but I'm retiring.
That's it. I'm out. I'll find something else to do. No, I'm serious.
I'm serious. You are.
I don't know if I could do it again.
Well,
I don't know if I'd have the energy to push through.
For the public, can I say thank you for letting us milk you dry?
Thank you. Thank you.
It's horrible,
no,
but it's
true.
true.
Is a privilege. It is, at the end of the day, in all honesty, I do see it as a privilege to be able to do.
Can I tell you what I take away from this chapter? And I'm not kidding. I genuinely spent my time talking to people who had horrendous experiences with COVID, and there I was sitting pretty, so that was my, pathetic experience. But for me, two things. I saw a tribe. I saw, as people, little tribes coming together, whether it be like little neighbourhoods, people having picnics across the fence from each other, families coming together. I felt like this world that's gone back into people connecting online and everything, but we started to realise contacting online wasn't meaningful. We need face-to-face, we need connection, and we need to back each other. And I really saw this kind of fundamental tribal kind of quality of interface of people, and I saw that, and it was beautiful. I also saw that when the shit hits the fan, we can be pretty innovative. I saw that the world can make dramatic changes and become incredibly resourceful when we need to, when there's urgency. And it made me hopeful about the environment, because our environment is spectacularly screwed. And we've got a sense we've got time for that, So, but if there was ever some sort of call or action of now, urgent, that we would have the innovation and the pioneering spirit and the sense of responsibility to actually action change. And I saw what we as humans were capable of. Yeah. Obviously the ugly side too, and that was inspiring. In a very broad existential level.
Well, even the vaccine itself, if you had said to me, because we just wanted a vaccine, like everyone wanted a vaccine, wanted it to go away. If you had said to me that we would have a vaccine 12 months later,
no,
I would have said no way, unheard of.
No.
But so many people put down everything else and just worked on that.
Focus their energy.
So many people came together and worked together. All of the red tape stuff,
bureaucracy
was gone because they put special things in place to be able to fast track.
And look what we can do.
And a lot of people, how does a vaccine happen so fast? I'm like, imagine if one person paints a house, how long that takes, 2 weeks, 3 weeks. Imagine 1,000 people painting that house. That's what it takes. It takes, having all those people investing, and exactly what you're saying around the environment.
Yep.
Rather than having one person paint the house, get 1,000 people to paint the house, and imagine what you could come up with.
Yeah.
Imagine how quickly
we're capable.
We're 100% capable. Yeah.
So that's what I took away. Darling, I cannot thank you enough for coming along and sharing your experience. It's often the case that when we have these big events happening, we don't stop and reflect. We just keep moving on, and this is the time to learn.
It is.
And appreciate, and I deeply appreciate your efforts.
Thank you so much.
Thank you. Thank you, darling. All right. So everyone, if you want to catch me online, we've got the website, KirstenHunterAuthor.com, Facebook and Instagram, Kirsten Hunter Author. Did you know we're on TikTok? I know.
I did not know, but I'm not on TikTok.
Yeah,
so
well, there you go.
there you
Dr.
go.
Kirsten Hunter. And YouTube, Psych in Your Car, all over the place. But basically, jump on the website and you'll find me, kirstenhunterauthor.com. Thank you, darling. Appreciate it.
Thank you.
See you.
See you.